Hi, you guys. Welcome back for our daily practice questions. It is day 192 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of the resources that I offer. And if you're looking to join the upcoming 5-week intensive review, there's 3 days remaining in the early bird enrollment option that saves you $100. Class runs from August 11th through September 12th. Click the link in the description to join. All right, y'all. Question number one. A 10-month-old infant presents with nasal congestion, cough, wheezing, and mild respiratory distress. RSV is positive. Pulse ox is 96% on room air, and the infant is feeding well. What is the most appropriate outpatient management? Is it A, start albuterol nebulizers every 4 hours? Is it B, prescribe amoxicillin for 10 days? Is it C, supportive care with nasal suctioning and hydration? Or is it D, start oral steroids for 5 days? Take a moment and tell me what you got in the comments, you guys. All right, y'all. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the most appropriate outpatient management? So, management, treatment, all same thing. So, as I always tell y'all, run it back and look and see if they provided you with a diagnosis first, right? In this situation, they have RSV is positive. So, think RSV, bronchiolitis, and thinking about how you would treat outpatient for this diagnosis. And, the main management that we do, especially from an outpatient standpoint, is C, supportive care with nasal suctioning and hydration and encouraging hydration for these patients, okay? Question number two. A 4-year-old child presents with fever, cough, and decreased breath sounds on the right. Chest x-ray confirms lobar pneumonia. What is the first line outpatient antibiotic? Is it A, amoxicillin, B, azithromycin, C, cephalexin, or D, clindamycin? Take a moment and tell me what you got. All right, so stem of the question here. What is the first line outpatient antibiotic? So again, this is a treatment question. Run it back and see if we have a diagnosis provided. And we do. So we're dealing with a 4-year-old child who has pneumonia, right? So first line therapy for pneumonia with the kiddos is your amoxicillin, high dose amoxicillin. Now, for your atypical pneumonia for children, we go with azithromycin, and we typically do that more with the older kids. But first line therapy, amoxicillin. All right, lastly, question number three. A 2-year-old child presents with a barking cough, inspiratory stridor, and hoarseness. Vitals are stable and there's no drooling. What is the best initial outpatient treatment? Is it A, oral dexamethasone? Is it B, azithromycin? Is it C, inhaled albuterol? Or is it D, augmentin? Take a moment and tell me what you got in the comments, y'all. All right. So again, stem of the question, what is the best initial outpatient treatment? Again, we got to run it back and see if we are provided a diagnosis. When we're asked for a treatment option in the stem, look and see if they provided you with a diagnosis. If they haven't, you got to run it back and look at the assessment findings because we got to know what it is to be able to treat it, right? So here, the diagnosis is not provided. So let's see what's going on. So when you're looking at these assessment findings, you want to look at the age, the gender, the ethnicity as well, because if that's provided to you, this can help with treatment, engaging how you would proceed. For example, in this scenario, knowing that this is a 2-year old, this helps to think about differential diagnoses, right? A lot of times I get people to say that, hey, I just kind of read across that, but I didn't take that into account. Yeah, and that's how we can miss stuff because you need to identify adult versus child, right? But in this case, looking at the assessment findings of the signs and symptoms, that bark and cough is a key identifier, right? I always say know your key identifiers. Like when I say this, you say that. If I say bark and cough, you should say croup, right? So here, this is classic presentation for croup in a child. And so then you want to ask yourself, what's your best initial outpatient management or treatment for a child with croup? And your best answer is A, your oral dexamethasone, because it's going to help open up those airways. Now, if they were to tell you that this was like a moderate or severe case, you can definitely still give that oral dexamethasone. But remember, we are providing outpatient management. And remember, you need to refer to the ER for further management and treatment, okay? So pay attention to what they're telling you and make sure you are prioritizing what we can actually do in the scope that we are in practice, as well as what is safest. Okay. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel, including my website. And as I mentioned earlier, my website is also linked in the description. It houses all of the resources that I offer, and it's broken down for first-time test takers as well as those who are retesting. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.